Split personality and trauma. Well, first about me. I have a very personal stake in the matters discussed here, and I've tasted many of the conditions and mitigation strategies that I mentioned. Uh, I believe I experienced severe trauma in early childhood, and I have pseudo memories that persist into old age. They try to resurface as poorly remembered dreams. However, this video is most definitely not about me specifically, because we're all different, and I want to honor our differences. And I do not offer myself here as an ideal or an example of how to cope with these troubling experiences or with mental health challenges in general. I do have a modest amount of clinical training, but certainly I'm not a clinician of any sort, although many of them I found quite wonderful. What is meant by the term split personality? For decades, split personality meant, in common usage, schizophrenia. There was a reason for that. The word comes from two Greek roots meaning split mind. But Bleuler, the pioneer from centuries ago, he was referring to fragmentation of thought, emotion, and behavior, whatever that might mean, not fragmentation of memory or personality. The real split personality, and it is a widely accepted phenomenon. It's the clinical condition defined in the DSM as dissociative identity disorder. The DSM, the Bible of psychiatric and psychological diagnosis, consists of a catalog of labels with the corresponding criteria that tell the clinician exactly how to decide whether to apply the label to the person they are working with. I have many personal issues and frank criticisms about the DSM and psychiatric diagnosis. However, consider the alternative. Consider what we had before the DSM. It was total chaos. Every school of thought had their own vocabulary, their own definitions, and nobody really knew what the other people in the other school of thought were talking about. And of course, this led to chaos. So anyway, we're going to start with the DSM. The criteria there, I'm going to quote them. Dissociation of identity characterized by two or more distinct personality states, accompanied by related alterations in affect, behavior, consciousness, memory, perception, cognition, and/or sensory motor functioning. Affect means the outwardly manifested mood or feeling. Cognition is thinking. But, this sounds like medical mumbo-jumbo. What is it really? Well, in 1957, a book was published, The Three Faces of Eve. It presented an actual clinical case. In her daily life, Eve, that's a pseudonym of course, would split between being the quiet, anxious, and withdrawn Eve White, the impulsive, flirtatious, and rebellious Eve Black, and sometimes Jane, a more balanced blend of the two. She had memory blackouts, and they weren't caused by alcohol. But one of her personalities sometimes had complete amnesia for things that were done by the other personality. Nobody really knows, there's no smoking gun about the cause of dissociative identity disorder. In her early childhood, Eve had undergone a series of 3 traumatic events before the age of 2, a drowning, a severe accident, and a funeral, and it's commonly believed that trauma of one sort or another leads to this condition. By the way, she got better after psychotherapy. Another famous story that I won't discuss here, but you may want to look up, is the one called Sybil. As I said, it's widely accepted, maybe not universally, that severe trauma, especially sexual abuse at an early age, causes dissociation. Well, I've been using this buzzword, dissociation. What is it? It's a psychological phenomenon, a state of mind, or I believe a state of the spirit, the soul, a condition in which there's one form or another of disconnection. It's a broad term, going beyond this particular condition. For example, incest survivors often report that they were floating around up on the ceiling while the stuff happened to their bodies. That's dissociation too. Closer to today's topic, when one personality state is separate from or inaccessible to another personality state, that's dissociation as well. And as I said, many members of the dominant incest recovery self-help program attest to the link between trauma and dissociation. I would like to prove the cause of dissociation, determine the role of trauma. I'm working on it as a citizen researcher, but I sure don't have the answer. Frequently, traumatic experiences of this type are not remembered. Centuries ago, pioneers of neurology and psychiatry worked on it. Jean-Martin Charcot, Pierre Janet, and later Sigmund Freud. Often they treated a related condition called hysteria, which literally means wandering womb, uterus. And the term was adopted because in those days it was mainly female-identified people, women, who sought help. They reported cures, typically involving hypnosis and recovery of the repressed memories, re-experiencing. Again, I want to mention members of the prominent Incest Recovery Fellowship. Many or some actively work to recover their lost memories. I'm going to digress a little bit. This type of trauma, when experienced in childhood, is widely believed to lead to specific personality traits. And it's very diverse, but some of it is captured by the term codependence. I personally have codependent traits. I would describe my own self by saying that large parts of my personality simply did not develop. My language of love often is helping people, which of course is limited and limiting, but I get by. But again, this isn't really about me. Your mileage may vary. The DSM mentions a related condition, borderline personality disorder, that can be triggered by early trauma. And of course, there is post-traumatic stress disorder. And there's something that the therapists believe in called complex PTSD. The American Medical Association has repeatedly blocked recognition of this condition in the DSM. And the result is that it's difficult or impossible to conduct research into the causes and treatment of complex PTSD. Borderline personality, I want to mention a mitigation strategy, dialectical behavioral therapy. It can lead to at least a partial management of the huge problems that, dare I say that people experience. It's a collection of coping skills and strategies. The group therapy sessions are often like a classroom, educational in nature. It was invented by Marsha Linehan, who came out as a professional, publicly admitting in the New York Times that she had, or at least in her youth had, the condition herself. Of course, she did this after she had earned tenure. She was no dummy. The focus of my own personal interest in these matters is the effect of trauma on memory. I mean, I for a long time I was a computer scientist, and memory is, it's part of that scene as well. Traumatic events are frequently not remembered, or more accurately, they're not remembered in the ordinary way. And as I have said, when the personality splits, one personality state may not have access to the memories of another. No one quite knows why. Human memory, or memory in any species, is quite complex. There are many systems involved and many paradoxes, and this will be a subject of another video. Finally, my channel, New Age Psychology, has quite a few videos that may provide insight or helpful suggestions or validation to people who have experienced trauma. One of them, and I'm going to post a link, is an introduction to reading about trauma, and that video mentions some useful books for trauma survivors. Finally, I want to mention one of my own strategies, which I do not advocate or endorse, but I acknowledge that I found it helpful. I think about the religious figure Jesus Christ. To me, the ultimate trauma survivor. What he underwent, or what he is said to have undergone, well, it's over the top. So that helps. But I am not trying to convert anyone, and I'm sure there are many other options. Finally, I want to emphasize again, I do not endorse or recommend any specific program of recovery or therapeutic modality, mainly because I'm a citizen researcher and by nature a teacher, not a clinician. Thank you for your attention.